The topic for this video is, can we reverse a receding hairline? It is indeed a trick question, because if you were to ask, the truth of dealing with any form of hair fall or hair loss is beyond frustrating. But if you do have a receding hairline, just remember two things. First, you're far from being alone, because it is an extremely common condition that we see these days. Secondly, do not lose heart, because there are a handful of options that can actually help you out. Hello, I am Dr. Monika Rajpal, Senior Consultant Dermatologist with Apollo Hospitals, Noida. So when we talk of a receding hairline, what exactly does it mean? Well, simply put, when the hairline moves away from the face and the forehead becomes broader and bigger in size, that is simply what we call receding hairline. It can affect both men and women, but it is far more commonly seen in men. The various causes which interplay to produce this, it is usually a combination of genetics and age, and other factors like stress and smoking often add on to it. Certain hormonal changes like menopause can be responsible for this condition in women. Certain hairstyles like tied braids, ponytails, use of hair extensions, which are so commonly being used these days, can over a long term can result in about traction alopecia. And so it is always wise to wear your hair loose and keep changing your style often. A rare medical condition by the name of frontal fibrosing alopecia can also be a possible cause. Now, there are various treatment options that are available to us. Minoxidil solution is the only FDA approved treatment that we have for both men and women, and it has been shown to give good results. However, in a few patients, it can cause itchiness of the scalp and facial hair growth. And of course, in these situations, we have to discontinue the treatment. Melatonin solution is a newer drug that we are now trying out in early stages of receding hairline, with the advantage that it has a much better tolerability as compared to minoxidil. Oral finasteride is a molecule which is approved only for men, and it has shown reasonably good results by stopping both the hair shedding as well as stimulating new hair growth. However, being an oral medicine, it can have its possible side effects, so always please discuss it with your dermatologist before you decide to start it. Now, whenever you're taking these solutions and pills, it is important to remember that a consistent use of about 6 to 9 months is essential to see optimal results. And any new hair growth that you see because of these medicines is temporary and is it likely to shed off within 3 to 4 months of withdrawing the medicine. Another modality that is commonly being used these days is what we call PRP, or platelet-rich plasma, in which the blood is harvested from the patient. It is centrifuged to get plasma which is rich in growth factors, which is injected into the bald areas. It has shown variable results. Hair transplant is probably the only permanent and the most promising solution, especially in advanced cases of receding hairline. In this, hair follicles are harvested from the donor area and implanted onto the bald areas. If done properly, it can actually have very promising results. In addition to offering these treatments, your dermatologist may perform a few basic blood tests like your thyroid function, and also to rule out iron and vitamin D deficiency, because they may at times be adding on to the hair fall. So what is the outlook? When you begin to notice a recession in your hairline, it is extremely difficult to predict to what extent it is going to recede. In some people, it may be the first step to going completely bald, whereas in others, it may just be a slight change which may never extend any further. Now, as doctors, whenever we start any treatments, our main motive is to prevent a worsening. So if you see any new hair growth as a result of the treatment, it is most definitely a reason to celebrate. Now, the success depends on how early we start the treatment. So the sooner you visit your dermatologist, the better, and consistency will always be the key to success. Thank you.